to look at my order, and I have Betty Jones, date of birth 5/21/1952 on my MAR, and she's getting 1 unit of packed red blood cells, and she has no known allergies. So I'm going to gather all my supplies. I need saline, alcohol, tape, tubing for a blood transfusion, saline, and gloves. Knock knock.
Hello.
Hi, my name is Kathy. I'm going to be your student nurse.
Okay.
I'm just going to wash my hands here really quick. And provide privacy. Okay. Can you tell me your name and date of birth, please?
Betty Jones, 5/21/1952.
All right. So I have an order here to give you a unit of packed red blood cells today. And I see that you have your signed consent form that you went over with your physician, and he already went over with you blood transfusion side effects. So some of those would be a bad reaction would be like if you have trouble breathing, chest pain, lower back pain, dizziness, itching, nausea, anything like that. Okay, let us know, and then I'll be in here monitoring you as well.
Okay.
Okay. Okay. So at this point in time, I would get a set of baseline vitals, and I would listen to the lungs to see if there's any fluid in there. If there is, I'd want to note that before starting the transfusion. Betty, can you take your arm out for me, the one that the IV is in, so I can take a look?
Yep.
Okay, so I've assessed that my patient can understand and follow commands. So I'm just gonna look at the site here. There's no phlebitis. It's not warm. It's not infiltrating. Does this hurt? Does everything feel okay?
It all feels okay.
Okay, so now I'm gonna make sure that it's patent. I'm gonna clean the site for 20 seconds. Make sure the lock is off. I'm just going to inject a few milliliters here, make sure that there's no infiltration, and then also make sure that I have no air bubbles. I'm not injecting air bubbles. Everything looks good. Does that hurt? Does it feel okay?
It feels okay.
Okay. Put my lock back on here. I also want to note the gauge of the needle. Betty has a 20 gauge IV. We would want an 18 to 22 gauge for doing a blood transfusion. She has that. My modifications across the lifespan, if this were a child or an older adult, we might not be able to use the peripheral site. We might have to use a central line. And then I'm going to want to monitor my patient regardless of their age for transfusion reactions. But I just want to take note that older adults have more problems with heart disease and kidney disease. So I really want to watch that fluid overload in case that happens. Okay, so I'm going to call down for my unit of blood. And then while that's going, I'm going to get my saline ready and hang my line. So normal saline is the only thing that we can run with blood. And I'm going to look at my bag. note the expiration date, it's not expired. There's no holes in my bag. There's nothing floating around in the fluid inside. Everything looks good. So I'm gonna grab my tubing. Okay. I'm gonna make sure that all my clamps are on. That clamp is on. This clamp is on, and my roller clamp is on.
It's close.
Spike my bag. And my saline.
Wait.
Okay. And I'm gonna fill my chamber here with my saline. I'm gonna fill it above the filter because when I hang my red blood cells, I don't want them to hit that and lice, so I want to make sure I have enough saline in here. And then I'm going to run saline down to the bottom of my line here, get all the air bubbles out. Okay. That looks good. And then I am going to clamp my saline here so that when I hang my blood, it all runs smoothly through there. Okay, and I think my blood is here.
Here's your blood.
All right, thank you. Okay, so I have my blood here. And I'm gonna look at the physician's requisition form here. And I'm gonna see that the physician ordered 1 unit of packed red blood cells for Betty Jones, 5/21/1952. Betty Jones, 5/21/1952. And then I'm gonna have Jackie wash my hands here, put some gloves on, grab my bag, and then I'm gonna have Jackie help me verify everything with my patient. I want to make note that once the blood reaches room temperature, it can only be sitting out for a half hour, so I have to get that infusion going right away. And then the line that I'm using can only be used for 4 hours, so I want to make sure if I have more than 1 unit that I'm changing the line or ensuring that it all is getting used within that 4 hours. Okay, so I'm just gonna check here on my bag that I have Betty Jones, and then I'm gonna check the red armband tag, which is 456654, and this is 456654. Okay, so now I'm gonna verify with Jackie. I have Betty Jones.
Betty Jones.
Okay, armband number 456654.
456654.
Med record number 224466.
I have 224466.
Location HLRL.
I have HLRL.
Account number 123456.
I have 123456.
Patient blood type B positive.
I have B positive blood type.
Donor pool 7890.
I have 7890.
4 units in the pool.
I have 4 units in the pool.
Volume to be infused is 250 milliliters.
I have 250 mLs per volume.
Packed red blood cells.
And we have packed red blood cells.
Expiration date 11/21/2022.
11/21/2022.
At 1500.
At 1500.
The donor blood type is O positive.
I have donor O positive blood type.
Compatibility test was completed.
I have the compatibility test has been completed.
On 8/26/2022.
8/26/2022.
Okay. Alright. Wash my hands. So I just want to make sure that I have everything I need. My tubing is all connected. It's where it needs to be. I have my blood. Everything's ready to go. So I want to check the bag. I already checked the expiration date with Jackie. Want to make sure that there's no holes. Kind of move it back and forth. Make sure that there's no clotting, air bubbles, and that it's the color or the appropriate color that it needs to be. Stick my bag. Alright. Now I want to run the blood through the line all the way to the bottom here. So that's what my patient's going to be getting. I don't want to waste any blood. I just want to make sure that it gets all the way to where it's going to enter. Especially because I'm going to be sitting with my patient for 15 minutes and I want to make sure that they're getting blood and not saline. Okay, that looks good. I'm gonna get an alcohol swab here. I'm gonna clean this for 30 seconds. And I'm gonna give it time to dry. Okay. Change my gloves just in case I got anything on them. And now I'm gonna set up my pump. Okay. Okay, so I'm gonna turn my pump on here. guardrail IV fluids. I'm gonna do red blood cells. I'm gonna start at a rate of 50 milliliters an hour. My bag says 250 milliliters, but I'm gonna do 200 to start off so I don't run my bag dry. So I'm gonna start that. And make sure everything's going through there properly. So I'm gonna stay with my patient for the first 15 minutes of this infusion. I'm gonna make sure that they don't have an infusion reaction. If they do have an infusion reaction, I'm gonna stop the infusion immediately, contact my provider, stay with my patient, make sure they're safe, and follow my facility protocols. I'm at the end of those 15 minutes, I'm also going to take my patient's vitals again and listen to their lungs, and just kind of note fluid overload if there's anything going on there with that. And then at the end of that 15 minutes, per facility policy, I can change the rate here kind of just depending on what's appropriate for my patient. So I might change the rate to 100 milliliters an hour. After that, and then I'll want to keep monitoring their vitals as well. It might be like every half an hour, every hour. After that, after this bag of blood is gone and all the blood has gone through the IV line, I want to make sure that everything is getting to them. So I am going to run the saline just so that all the blood can go through. So then I will black my blood here, open up my saline, change my rate to 50 milliliters an hour, and it should only take about 50 milliliters to get through the line. And I can start that. So then I want to make sure throughout this whole process and before I leave the room that my patient is safe and comfortable, the bed is down, they have their call light, their IV is feeling okay, and then clean up my mess. I'm gonna wash my hands before I leave the room. And then I'm going to document. So I'm going to document how much blood there was, when it started, when it stopped, what the blood type was, the selection number, the unit number, where the site was, the size of the catheter used, how my patient responded to the procedure, the vital signs. I'm going to record those as well. And I think that's it. Thank you.